It's vitally important that each AT participating in the demonstration project follows the rules carefully and reports to the OATA as required. If you don't follow the rules, the results will be skewed. If you don't report, we won't know what the results are. Either way, the demonstration project won't be successful. So please follow the rules and report. The rules vary somewhat from POC to POC, and we will go through the POC-specific rules during subsequent webinars. But there are some rules that are common to all the programs of care that we need you to pay particular attention to. Each POC will identify eligibility criteria. In other words, criteria that identify whether a patient is appropriate or not for treatment in that particular program of care. Eligibility criteria are usually the number of days post-injury or post-occurrence before treatment can begin, and the presence or absence of what we refer to as red flags. Please religiously observe the eligibility criteria. If you don't, you'll end up treating patients who don't really belong in the POC, for whom the POC isn't expected to be successful, and doing so will skew the results to your disadvantage. If the patient isn't eligible for a particular POC, according to the rules, but you want to treat them as if they were, that's fine, but don't include them in the demonstration project, and don't provide discharge reports to the OATA on those patients. For purposes of the demonstration project, make sure you include and provide discharge reports on only those patients who meet each POC's eligibility criteria. Each POC will also identify its own red flags. These are things that you should identify during the original assessment, but they might also appear or arise during treatment. Red flags are things such as psychological conditions or other health conditions or situations that are obstacles to successful treatment in the POC. When you identify a red flag, that means that the individual isn't eligible as a patient for the demonstration project. Treat them however you like. Treat them with the POC menu of treatments if you like, but don't count them in the demonstration project and don't file a discharge report for them. It should be obvious that if the demonstration project includes a significant number of ineligible patients, your results are going to be lousy, at least relatively worse than your competitors, namely physiotherapy and chiropractic. Each program of care will also demonstrate yellow flags. Again, yellow flags should be identified during the assessment, but may also be identified or arise at some point during the treatment cycle. Yellow flags don't mean that your patient can't be part of the demonstration project, and don't mean that you shouldn't file a discharge report for them, unless, of course, you feel that there are so many yellow flags that they really amount to a major obstacle to successful treatment within the POC. In such cases, it's your decision to exclude such a patient from the program of care and the demonstration project, or include them if you wish. Once again, treat them as you like and in their own best interests. If you decide to exclude them from the demonstration project, just don't include them in your discharge reports. Stephanie has been beating the bushes to secure enough ATs and a cross-section of ATs to generate a statistically reliable sample of performance. That's who you people on this webinar are. The demonstration project will last for a year, perhaps longer if it's necessary to generate a statistically reliable number of cases in each POC. I can't emphasize enough how important full, accurate, and timely reporting is. Unless you report, the demonstration project will be for naught. With the WSIB programs of care, we found the number of practitioners who didn't report at all, or provided reports months or even years after discharge, or didn't provide complete reports really frustrating, because we couldn't accurately track volumes or results. So the WSAB made payment of the block fees conditional on the receipt of discharge reports. We're not going to do this in the demonstration project. We're simply relying on the goodwill and commitment of the participating ATs to report as required. The only report we are asking you to make is the discharge report. And we are asking you to submit a discharge report for each patient as soon as you possibly can after each patient is discharged from the program of care. Discharge means when you determine that the patient has returned to pre-injury functionality, if the patient withdraws from treatment by going on an extended vacation, by severing the patient-practitioner relationship, whoops, I just lost my, with you, or by doing anything that obstructs your ability to provide the program of care, or whenever a red flag appears or a sufficient number of sufficiently serious yellow flags appear to obstruct your ability to successfully deliver the program of care. When any of these happen, submit a discharge report for that patient. For each POC, the discharge reports can be found on the OATA website. They can be completed and submitted electronically, which we would prefer, or in hard copy by mail or facsimile. It is very important that we absolutely protect patient confidentiality in the discharge reports. By this we mean that you make sure that there is nothing in any discharge report that identifies a patient or could be used to identify a patient. You will be asked to create a patient identifier that allows you to cross-reference the discharge report with your records, but is completely blind for all other purposes. The discharge reports will be received, reviewed, summarized, and analyzed by a certified health information manager at arm's length from the OATA and at arm's length from the CG group. She will provide an aggregate analysis to the OTA of the results for each POC. I believe that copies of that aggregate analysis will be provided to each participating AT who asks for a report. She could also provide a confidential report summarizing how the performance of each participating AT clinic or each participating AT stacks up against the mean or the median performance levels of the other participants in the POC. If that's something you'd be interested in having, and if the OATA agrees, I'm sure a program could be devised to provide that information. Everything we do in this demonstration project must comply religiously with the requirements of the Personal Health Information Privacy Act, FIPA. Everything that you need to follow the PCs for the demonstration project is on the OATA website. Here's the contact information you need if you have any questions or whatever relating to the POCs. As I said earlier, there will be future webinars dealing with the details of each POC being used in these demonstration projects. A webinar on mild traumatic brain injury and the acute low back injury will be held on May the 15th. A webinar on the upper extremity injury POC and the lower extremity POC will be held on the 22nd of May. That's it for the formal presentation for this webinar. Stephanie, Sarah, and myself are now ready to respond to whatever questions or comments you might have.